A slight vaginal discharge may be normal for every woman, usually after a sexual intercourse or after or during your ovulation time. But what happens when this vaginal odor that may be interfere with symptoms called mainly a vaginal discharge or itching or burning sensations? In this manner, you may go for a infection called as infection of vagina called as vaginitis. So today we are going to discuss about the several types or the common causes of vaginal odor and symptoms and preventive measures. So don't skip this video. Let's go.
I played it innocent, a feel of discontent. I'm finally facing it all, fearless.
Let me discuss one by one. First, we are going to discuss about the common risk factors. The first risk factor is woman with a poor vaginal hygiene. In this manner, you may also get a infection and it will lead to a symptom called as vaginal odor. And the next common risk factor is a pregnancy. In pregnancy, you may also feel so much of discharges that will also lead to formation or occurrence of vaginal odor. And the next common risk factor is if you uses a douches that will mainly create an infection that will lead to these symptoms. And the next common or the last common thing is you may change your sexual partner, mainly a multiple sexual partner that will also lead to this vaginal odor and vaginal infections. So these are all the common risk factor for the occurrence of vaginal odor. What is the common cause for this vaginal odor? The first common cause including if you have a bacterial vaginosis. This bacterial vaginosis mainly tends to be overgrowth of your vaginal bacteria that will leads to the formation or the occurrence of a symptom called as vaginal discharge with vaginal odor. And the second common cause including if you have a sexually transmitting disease, mainly a trichomoniasis vaginalis. So in this disease you may also get the vaginal discharge with vaginal odor. And the common cancers including vaginal and cervical cancer. In these cancers also there will be offensive vaginal discharge occurs with vaginal odor. So these are all the common causes or the common pathological condition that will show this vaginal odor. Even a diet can also changes your vaginal odor, mainly if you ate a fish or a garlic. So in this manner it will causes a hormonal fluctuations that will leads to produce these symptoms. So these are all the common causes. What is the common diagnostic method? Mainly a sampling of your vaginal discharge and a blood test and screening test. All these are the common diagnostic methods that will help to determine which kind of bacteria, which kind of microorganism that will cause this infection. Usually Gardnerella bacteria is the common pathological microorganism that will cause this infection. What is the common treatment methods? The treatment methods mainly including antibiotic therapy. So an antibiotic can be helpful to treat your infection in the form of a pill or a topical application. So this is the common treatment methods. So if it is not react to your antibiotic therapy, you can go for other procedures to prevent the complications, mainly a cancer. What is the common preventive measures? Mainly you have to go for a proper vaginal hygiene and menstrual hygiene, and also you have to maintain or you have to limit the usage of douches that will changes the pH of your vagina and that will create this symptom. And avoid unprotected sex that will also helps to prevent the sexually transmitting diseases. Avoid wearing a tight clothes that will also create an infection in your vagina. So these are all the major preventive measures that will helps to prevent the vaginal odor that goes into severe. So these are all the major preventive measures, and if you prevent your triggering factors, you can prevent your offensive vaginal odor. So that's all about today. Next day I will reach you with another topic. Thank you all. Have a nice day.